coming up. Mary, welcome back.
Thank you. Thanks for having me. Happy to be here.
It's been only like, what, a couple of months, but feels like a couple of years.
Every day feels like a lifetime.
I know, this is interesting. How do you feel? Like, what has changed so far?
Well, I think that we're still in sort of the state of confusion with what the CDC guidance says. We haven't heard anything specific yet from OSHA about standards. They're still sticking by their guidance that they issued all the way back in June. And the ADA still persists in putting out information that's contrary to what CDC and OSHA says. And so we're still in that state of confusion, but I think that it's becoming a little less stressful to teams just because they're getting used to it. I think they're becoming sort of numb to it, just like all the other craziness that's going on. But we have had a report now that is the completion of an OSHA inspection in a dental practice in Massachusetts. And this dental practice was cited for not having N95 respirators and not having a respiratory protection plan, a written plan, and not doing fit testing. So what we've been hearing from the ADA all along is that fit testing isn't required. And OSHA has disagreed with that and said, oh, yes, we do require it. We're just suspending the annual requirement. But if I were a dental practice and I was following that advice and I got cited by OSHA, I think I'd be a little upset. But everybody has to remember that the ADA isn't the regulatory agency. It's CDC, it's OSHA first, but OSHA relies on CDC info. So that's kind of the state of the union right now.
You know, it's kind of interesting. I think, do you think it's fair that people blame ADA for not having any say in what's going on if they're not regulatory agency?
Well, they can have some say, and they certainly have tried to influence OSHA. But way back in the late 1980s, when the hazard communication standard was being promulgated, the ADA worked really hard along with the American Medical Association to actually get dentistry exempt from the standard. And OSHA took a stand, and I think rightfully so, that you have hazardous chemicals in your offices. You have glutaraldehyde, you have mercury, because of course amalgam fillings were very popular still back then, and other, disinfectants and those types of things. So they didn't exempt us. And so unfortunately, by pushing back, and this is my personal opinion, by the way, by pushing back against the regulatory process, they gave up the opportunity to make it a little more realistic. And the same thing happened on a smaller scale with the bloodborne pathogen standard. But I think that the ADA, or I thought the ADA, learned their lesson when the HIPAA rules came out. They were right there and giving comments and suggestions and all that, and they made it a little more reasonable for a small dental practice. But they can say whatever they want to, ADA, but OSHA's charge is worker safety. So if OSHA determines that there is a hazard from aerosols, which has of course been the whole focus of COVID, then they're going to be pushing for safer workplaces. Now, do I think we have safer workplaces? Yes, because so many dental practices now have instituted air purification in their offices. They put HEPA filtering devices in their treatment rooms. They've at least looked at the number of air exchanges from their HVAC system, and it is providing better air quality. And we don't have evidence of what the CDC would call clusters of dental team members getting sick with COVID. So that's the good news. But we still need respiratory protection. And I think a lot of practices just sort of got hung up on the early days of not being able to get the appropriate respiratory protection. And now they've sort of given up and haven't gone out and pursued that lately when the supply is starting to ease up.
Mm-hmm.
So
that's what I think is interesting. Like with I kind of distanced myself a little bit in the last month from PPE and all the craziness. And, obviously we went from not having masks. Now we have masks, then the gowns, then the cavi wipes. Now I think the gloves has become a big issue.
Mm-hmm.
So, you and I were kind of joking a little bit about this. Like what's going to happen if we run out of gloves? Like, can we still see the patients? Obviously not.
No.
We didn't get to that point, right? So we don't have that, like where we have to stop. Yes, the prices went up crazy, but people are still able to get the product. So what craziness have you seen among the dental offices that kind of like you raise your eyebrows and say like, how did we get there?
Well, I think it's people listening to advice that they hear from other people, and especially with regard to disinfectants. When we found that Cava wipes and other disinfectant wipes were in a huge shortage, then people were just like grabbing anything that they could get, not knowing whether it was tuberculocidal, whether it was going to interact with the product that they already had been using and was already on surfaces. And so some interesting things happen. And then I've heard from so many people that have said that their sales reps from one particular distributor have told them, just make up your own wipes. So you take 4x4 gauze and you put them in a container and you pour the liquid disinfectant over it. But you can't do that because the fibers in the gauze bind up the active ingredient in the disinfectant, and then it doesn't do any good. So there's ways to still, we don't have to go back to the days of spraying the disinfectant all around like we used to, because that's hazardous to the team. But you can get a spray bottle. You can get liquid Cavicide and other products, and you can spray that onto a gauze and then go over your surfaces, or use a paper towel and go over your surfaces that way. But that's probably the biggest craziness that I've seen, or people trying to disinfect their gowns. They don't like the directive from CDC about changing their gown. And so they're spraying them with disinfectant, which then probably does away with any of their fluid resistant properties. Some people are fogging the gowns. They're fogging the team members after they finish with a procedure so that they can reuse those gowns. And, we don't have any evidence of whether that's a safe thing to do or not. So I think it's kind of like the do-it-yourself kind of techniques that are scary, really scary.
Mm-hmm. So it's like, remember back in the days when you and I, had normal conversations before COVID, right? Like we talked about how, some dental offices don't have the proper sterilization processes and all that. And we were joking about it. Like, now, it would be great to know exactly what to do in the procedures and things like that. And we were talking about some crazy examples of how people would do things I don't even remember by now. But now it's like with COVID, it's double because obviously there's a cost involved, right? And I'm pathetic to single practitioners that used to pay, let's just say $500 a month on just PPEs. Now it's $1,500, $2,000 a month on PPE. The prices have gone up tremendously, and maybe there's a shortage of patients and things like so. They have to manage the business. But I think what I'm missing, and I think you're on the same page about this, is there's certain guidelines that we have to follow.
Yes.
We may agree, we may disagree, right?
Yeah.
But it's sort of interesting how it's okay to bend some of those guidelines. And I think what I'm trying to figure out is with offices, and again, we're very empathetic, like with the gowns and things like that. We're trying to come up with solutions.
Right.
We've gone and found the reusable gowns that people can buy a whole pack of it, wash it in the dental practice and things like that.
Mm-hmm.
But how do I guess maybe it's kind of like a more philosophical question, but how do we get to the point where the guidelines are the guidelines, we're following them, and every office should be following them? And then within the guidelines, as products come out, let's get creative on the product side, not on how do we bend the rules about using the products and stay compliant with using the product.
Right. Well, you're exactly right, Tiger. It is a philosophical issue. Dentistry historically has not been a highly regulated profession like medicine. They have not had to follow any accreditation guidelines. It's essentially following the dental rules for each state that haven't, at least in the past, gone into a lot of detail about infection prevention, although that is starting to change. There's a matter of ethics, doing the right thing. And, there's kind of I think the spillover from everything else that's going on in our country right now, that ethics isn't always the most important thing to a lot of people. And they're putting the business and profitability before safety. I think there are many dental professionals out there that still believe that this is not a serious illness, that it's not a serious problem. And so they don't understand why we have to do all these things when it's just such a silly little thing, but it's not. And, I think the evidence of 210,000 plus people dying is evidence that this is a serious issue that we have to deal with. So it's how I feel about being a dental professional. My job is to protect my patients. My job is to provide the best quality care that I can in a safe manner. And if I'm the employer, it's to protect my employees and then myself. For even selfish reasons, do the right thing to protect yourself and your family. But people get hung up on the profitability issue. And I totally agree. It breaks my heart to see so many practices struggling to pay for all this PPE. And many practices are charging a small fee for PPE or infection prevention that doesn't even begin to cover the cost, but it's something. It's better than nothing. And patients are pushing back. And some states, Maryland for one, has declared it illegal. So if you're a dentist practicing in Maryland, you can't charge that extra fee. So
wow, I didn't know that.
Yeah, it's just not a good situation right now. And I think until the pandemic is over, until things get resolved, we're still going to kind of be in this state of flux. And it hasn't helped that the CDC has changed guidelines and, as we were talking earlier, withdrawn them and put them back in. But I think an important thing for everybody to remember that the CDC has updated guidelines based on new science, learning new things. I hear a lot of people bashing Anthony Fauci back in February, saying, oh, the masks aren't going to help. Well, we learned that the masks truly aren't going to help someone who might be exposed to COVID. The particles probably would get in around the gaps on the sides of those masks or face coverings. But what we now know is it's protecting the COVID particles from being aerosolized or projected from somebody who is infectious. And since we don't know all the people who are infectious, if they're asymptomatic and they haven't been tested, that's where the face covering thing comes in. And that's the one I just don't understand. When people say wearing a mask or a face covering is impinging on their freedom, come on.
Yeah.
I call it the freedom to be stupid.
Like my whole thing on this, just probably not even important, but not to get too political and like, I'm happy when I see people wear masks in airports. I travel a lot, and just sitting in an airplane or walking through the airport and somebody's coughing, I'm like, now they're wearing a mask. I'm happy.
Yes.
And the other part that I'm really happy when people now have to wear masks is the restaurants. Like when I see people prepping my food, I'm excited that now they're wearing the masks, and I know that nothing is going to on the food. So like, that's just, if we have to, we have to. I don't think it's a big deal.
No.
But again, it's everybody's right now is I think you and I can go on a really like long tangent if we talk about the politics.
Yeah.
But I think it's like, if the guidelines is there and there's a benefit, why not? And I totally agree with you. Like if somebody is sick, like one of the ways to control it, they're just coughing in their own mask, and that's probably going to help.
Right. It's been shown to help. And the other concern with those new guidelines, or with the guidelines that were put back up again on the CDC website about the airborne transmission of COVID, is that it goes beyond that 6 feet of social distancing. So there was a study published in the Journal of the American Medical Association back in, I want to say January or February, somewhere in that nature, that talked about how viral particles, aerosols, can actually travel up to 26 feet. So it's not just being 6 feet away. Maybe we need to be further away, and especially if you don't have a face covering. So yeah, but back to your original question, I don't understand why someone who is a dental professional who has agreed by accepting a professional license isn't 100% committed to doing the right thing. Whether we agree or disagree with the guidelines, they are what they are, and they're there for a reason. And I would certainly want to make that really clear to my patients that we follow all of these guidelines because we value you. That then becomes, I think, part of marketing your practice. Our practice is a safe place to come. You can be assured that we do everything that we know how to do to protect you, rather than trying to cut corners. But that's happened in dentistry for a long time. It used to just make me crazy when I would do an OSHA compliance lecture, and everybody's always they're spending lots of time trying to figure out how to get around the guidelines rather than just comply and be done with it, and focus your energy and your time on producing the highest quality of dental care you can and developing your team, rather than spending all this time trying to find some kind of a workaround. That's just not productive time spent. Yeah.
That's a good question. Like just on that note, do you think the guidelines, when people hear when people hear experts talk and discuss the guidelines and CDC and OSHA and all these things, do you think they're though clear to follow? Like that you can somehow spend a half an hour, 15 minutes to be like, I got it. Now these are the things that I need to do, or it requires more time?
That's a great question. I think it does require more time, and there's two reasons. One is in dentistry, we've never had to look at some of these public health issues or look at what are called transmission-based or aerosol guidelines in our practices. We followed standard precautions, and it meant that we assumed that everybody was infectious or some kind of an infectious disease, and that what we wore, mask, gloves, eyewear, and gown, protected us. But when we get to these airborne droplet infections like COVID-19 or tuberculosis, or even things like measles, then there's a higher level of requirement or precaution that needs to be taken, and we're not used to that. So, and I've said this before, that I think a lot of practices thought that they were just going to go back after the shutdown, turn the lights on, turn the equipment on, and it was going to be business as usual. Let's cram as many patients in the schedule as we can. And they maybe changed to having people not wait in their reception room, they wait in their vehicles, that kind of thing. I think that's changed, but just not not enough change, and not taking it seriously. And I know that there are a lot of groups that say, well, it's really not a problem because we don't see these cluster outbreaks in dental practices. Well, not yet, but it's possible that we certainly would see outbreaks of flu in practices during flu season, just like you do in schools and all of that. And in areas where there's a very high community spread of COVID or flu, then our chances of being exposed are much greater.
Mm-hmm, mm-hmm. Yeah, I think that's one of the things that I'm always concerned about, is where I feel bad for dental professionals. Like, remember when I got on this thing about the KN95s and N95s? I remember we did a webinar back in like June or July,
Yep.
and I was like, oh, proud of myself for doing all this research and finding all the fit tests and all that. I'm like, now looking back, I spent probably 4 hours doing that.
Yeah.
And I mean, obviously dental offices can hire someone like you and you will do all the research, but I wish sometimes they would have been like, all right, dental professionals, click here. Based on the new regulations and guidelines, these are 15 things you need to do. Check mark. And then you're done, right? We don't have that.
No, we don't. That's one of the things that, and I don't mean to be totally negative about the ADA. That's one of the things that the ADA has truly attempted to do. But again, they're saying some of the things, and again, this is my personal opinion, they will say the things that they know their members want to hear. And so they will, have some obvious bias. We all have our own obvious biases, but it's not as clear. And I think another issue that we have in dentistry is that there's never been historically any one person in a dental practice who actually has some advanced training in infection prevention. There is an infection prevention credential available for dentistry through the Dental Assisting National Board, but those are kind of few and far between. It's, in a hospital setting or in the federally funded medical dental facilities, they have to do that because they have to meet accreditation requirements. And that's maybe, and I know, dentists would go crazy if they had to do that, become accredited, because there would be a lot of things that they would have to change. But that's the big difference, I think, between us and the other areas of healthcare, is that accreditation. You have to prove that you meet all these standards. And we've just been sort of flying by the seat of our pants in terms of infection control. Sadly.
Yeah, that's interesting. Yeah, like I would compare that back like to where I came from. You can't even open a freaking clinic without having somebody come in and inspect it for you. Not just like a building inspector, but like the clinical from a medical standpoint.
Right.
Here we're opening up the practices, just like put a chair, sterilize instruments, and you can see patients tomorrow and let's go.
Exactly.
Like, I love the freedom. Don't get me wrong.
Oh yeah.
It would be nice as a patient knowing like you go in and someone did the work and they did the checklist and things like that. So that's also my personal opinion. I don't mean that I tell people what to do and how to do.
Right. There just isn't that accountability. That's the difference, I think. And I know that there would be many dentists out there that would like to slice my head off if I suggested, but I think that some type of accreditation is a good thing. Now, there are organizations that a private dental practice, doesn't even have to be a federally funded clinic, can join and can go through all the steps to become accredited. And I think that, and I know a lot of practices that do that, but they're not the majority. But I think that would make a big difference, that folks know that they have to do these things or there will be consequences. So.
Yeah, that's interesting. Remember also, just curious, like there was something going on in the summer with team members and things like that. Like, what have you heard so far? Like, it became easier? Everyone went back to work, like things are normal, or things are still interesting?
Oh, I think it's still interesting. There were a lot of team members, hygienists in particular, who decided that they didn't want to work in a clinical situation anymore because they're concerned about the aerosols. And it's been difficult for dentists to find additional hygienists and dental assistants. It's not necessarily seen as the most desirable place to work now, especially because it's been, portrayed by OSHA in the media that it's one of the most unsafe professions. So yeah, there's still a lot of shortages. And then it caused a lot of disharmony on the part of teams where the hygienists and the assistants would be very concerned and critical of what they perceived was or wasn't being done. And I don't think enough of them actually sat down with their doctors and had a discussion, an honest discussion about why are we doing things? Why aren't we doing things? What are the implications? And really making it a collective effort and making safety part of the team culture. That, the doctors, and I totally get it. It's a very emotional thing for them to have their business closed down for 2 and 3 months. And they're just like, no, I don't want to do this. We got to get back to normal. We got to pay. We got bills to pay. I get that. But the downside of that is, an OSHA inspection. I mean, the inspection that happened in Massachusetts, if you read the report, started out with $24,000 in fines, and then it was negotiated down to $9,500, which is better, obviously, than almost $25,000, but still $9,500 on top of all the PPE expense that people are already incurring, maybe a decreased patient load. That's a huge financial hit. And I think those fines have to be paid like within a certain time and all at once. I don't think that's something you can like make a monthly payment on. So that's a huge
finance
hit.
It.
So yeah, I don't think you can finance that unless you do it personally.
Low interest payment
to pay it.
Yeah.
So it's a big risk, and I think that's one of the things that's kind of missing here is that a lot of dentist practice owners are not really thinking of or not aware of the potential liability from not following guidelines.
Mary, what's your outlook before the end of the year? Like, again, let's exclude the November, how that's going to affect what the whole thing is going to look like. But let's just say people talk about the second wave. I know that people are concerned about it. We have the PPE. Looks like we got our hands on gloves, not the gloves, the gowns and masks. So I think we're doing much better on that. The gloves is going to be an issue. Like, what do you think the October, November, December would look like before we hit the next year? Do we need to be concerned? Anything that the team members will need to do differently? Or new guidelines are going to be coming out? What's your take on that?
Well, I don't know that we're necessarily going to be having new guidelines coming out. I think we're kind of at a point where the body of knowledge has been incorporated into the guidelines that we have. I don't know. I wish I had some better insight into what we might expect from OSHA, because they may have to either amend the bloodborne pathogen standard, which has a lot of the infection prevention information in it, and increase the scope of it, and tie it into the respiratory protection standard, or come up with a whole new standard on aerosols. We don't know, but that's a lengthy process for OSHA. So I don't see anything probably happening in that arena until maybe after the first of the year. But there is some encouraging news. We keep hearing, oh my goodness, when the flu starts, and we have people who may be co-infected with flu and COVID, and what if we can't tell the difference whether somebody has flu or COVID, whatever. Australia in the Southern Hemisphere has just gone through their winter flu season, and they saw a huge drop in the number of cases that their public health officials are attributing to wearing masks and face coverings. So the good news that may come out of this, if we can get more people to comply with wearing face coverings and face masks, that we may not see that happen, but we are seeing spikes all over the country of COVID cases. New York, you probably heard on the news, is looking at closing down some businesses again in some of the neighborhoods where there's huge increase in cases. And you can attribute that to a lot of things. Some kids going back to school, young adults going back to college, more businesses, bars, and places where people tend to gather are opening up. I don't know that we will have to close down our dental practices again, but depending on what's going on in an individual community, there may need to be some decrease in the number of patients that we see. So in other words, if I have a practice in a community where there's a really high percentage of positive tests and cases and high number of hospitalizations, then I should look at, and this is in the CDC guidelines, I should look at which procedures could safely be postponed on some patients. Maybe they're patients that have the comorbidities of heart disease and diabetes and so forth, that maybe this isn't a good time for them to come in for routine care. We're going to postpone that. Or maybe there are some healthy patients that could wait a little longer for their preventive care because we have such a high number of cases in our community. Maybe there will be some hope for testing, but and a lot of people keep saying, oh yeah, we're just going to test our patients and then we're good to go. But the thing to know about testing is most of the testing that's available is for people with symptoms. We don't have testing widely available, if at all, to test people who are asymptomatic but may be already infectious. Those are the spreaders. Those are the people we need to worry about more than those who may have some symptoms, because if they tell us, or we know they're coughing or they have a fever, we can say, hey, go home, don't come in here. It's the people who may not know they've been exposed, have an exposure, they're infectious. We don't have a way to test them. So I don't know that testing is necessarily the answer in that case.
That's, that's something interesting for me. As I'm traveling in different countries, there are tests available within 2 hours.
Yes.
And for some reason, we still don't have them.
Oh, you don't want to get me started on that. That's a political thing, I believe.
Yeah. I think if we could have the tests available at every facility, every dental practice, that you can test within 2 hours, that could be something that will change the whole thing.
That would be a game changer if they also screened for patients who don't have symptoms. That's the thing that you have to, there's a gazillion tests. I shouldn't say a gazillion. There's a lot of different types of tests out there, but not all of them meet that need of testing for infectious but asymptomatic patients. And those are the things that, and just because I test negative now doesn't mean that I may not, by the end of the day, test positive. And that's
right.
It's just a snapshot of on October 7th at 11:39 p.m. I test negative, but that could change by the afternoon on the same day. So testing certainly is a helpful tool, but it's not the absolute answer. Although I think that it's encouraging to see some of the airlines that are going to implement some testing. But I just can't imagine how upset that people would be. I'm going to try to board my plane on United Airlines and go to Hawaii, and I test positive and they say, sorry, you can't get on the plane. I can't imagine.
As long as they tell you before you board, imagine you boarded, you're flying to Hawaii.
Yeah.
And they can't let you out of the plane. You got to go back.
Off. Or you have to, and I think obviously what they're trying to do is boost tourism, but if you didn't pass a COVID test, then you'd have to quarantine for 2 weeks. I mean, nice place to be quarantined, but it'd be an expensive place to be quarantined for 2 weeks. So hopefully we'll see some developments in more testing, more availability of testing, and a way to test for people who are infectious but asymptomatic. And again, if people are really being good, both inside a dental practice and out in public, the general public, wearing face coverings and doing hand washing and doing as much distancing as they're able to do, then hopefully we can decrease the flu, which would exponentially complicate COVID. But I don't see us having to go into a full-blown lockdown, close all the dental practices down again. I don't see that happening.
Yeah, it was horrible. Not that it was bad, or I mean, whatever. But you and I remember. I think a lot of people just went bonkers crazy about this. I don't think people were prepared. I also think we had a couple offices, by the way, that stayed open, which was interesting for emergencies, because there was nothing available in the region and they had to stay open for emergencies. They came out stronger than they were before COVID.
Right. Well, and any dental practice could have stayed open for emergencies, but there were many people that sort of stretched that definition of what's an emergency, what's truly emergent care. But yeah, and I am hearing the same thing, that there are practices that are coming back stronger. But what I'm finding is it's the practices who stayed in touch with their patients by email or social media, and then were very proactive in letting their patients know what was going to be different. If they were going to charge an infection control or a PPE fee, they let them know ahead of time. They didn't surprise them. Oh, by the way, there's an additional, $25 that you have to pay. And they kind of feel like they're being held hostage. It's the ones that really communicate well and tell their patients, we're doing all of this for you, we're making it safe, and they are stronger. They're doing very well. But I also think that many of them have taken a very close look at what's really important in the practice. And it's something that, that ties into Zen, that, am I just going out and willy-nilly spending all kinds of money on restorative materials and things that I don't really know that I need? I just think it's kind of a cool idea. I think they're being much more realistic about things now, and that will help them from a business standpoint.
Yeah, we're looking internally at some of the data and statistics. I think maybe, Irina, if you're listening, we need to publish some of the stuff that we find interesting. But from the data that I looked in May, June, July, August, and then September, it's really interesting to see the dynamics in the purchasing. And I was hoping that the people are going to be more cautious and careful coming out of the pandemic, but I have a feeling we're coming right back to where we were. Without really paying attention to how they spend and who they spend the money with. And that's probably my main concern is yes, there are vendors out there that weren't really for the doctors, in my opinion, when the pandemic hit, and whatever their reasons are, right? Like it's up to them to figure out why they weren't there. But I thought that there will be a shift in the mindset of who they're buying from, right? And right as soon as we came out of the pandemic, we're seeing the same trends that we were right before that. And so to me, it's interesting. To me, like, I still can't quite figure out why it happened, because like a major business shifted to other vendors. People were trying out working with different companies. They were providing the services and the products, but then August, September, it went right back.
Well, I think one of the issues is that the dental professionals are sort of creatures of habit, and they're in this comfort zone. In a lot of cases, this is the way we've always done it, so it's probably going to continue that way. They're slow adopters of change, and boy, they had a big change that they had to deal with, having their practice closed down except for emergencies. And too much change at one time for them is so uncomfortable that may be a factor in that, oh, we got to go back to what feels normal or feels right. And we all want to go back to some place that feels sort of normal. But I think that we're in a very different new normal now. I think what we knew, how we worked, how we did things before is forever changed because of this. I really think so. And we don't know. I still think of a presentation that I heard Dr. Anthony Fauci make a number of years ago that said it's only a matter of time before we have several of these. And he said that during the pandemic as well, that what's next? There could be another infectious disease coming. And in that case, hopefully we learned some lessons from how we worked in the pandemic and from changing some of our PPE and those things, that we're better prepared next time. Because we certainly weren't this time.
I'm actually curious, Mary, how has your business changed? Like, I know we've talked about entire compliance, and you're an expert in the entire compliance, not just OSHA, right? There are other things, all the parts of the compliance. How has it changed for you, and how is it, again, adjusting as the time moves on?
Well, first, it sort of went in different phases. In the beginning of the pandemic, it was so many people wanting webinars and coaching and, what is COVID and how do I prevent transmission and all of that. And then it was, okay, now how do I open back up? I need help with that. But what's really getting people's attention right now is that OSHA inspection and that $9,500 fine. And all of a sudden, everybody's concerned about making sure their documentation is up to date. So, and I've engaged a tremendous number of practices that I haven't worked with before, because they've just taken all of their documentation and training and things for granted. They've never done an annual training, or they did it, but then they stopped doing it and they haven't looked at their documentation. I would say the average is about 5 years that people go without even looking at their OSHA or HIPAA documentation. And so that's a big focus right now, is getting that documentation. The other thing that's done is shifted to virtual training, where so many of the major meetings, we talked about Chicago Midwinter, the Yankee Dental Congress in Boston in January has gone virtual. So,
is it?
Yeah, they did. And so I don't know. It's going to be interesting to see what happens in the industry from that aspect, that whether or not many of these meetings will go back to doing in person after the pandemic, or whether they'll continue to do virtual meetings. I think it's a great learning experience for all of them, but I think it enhances the ability for people to learn, because it provides it in a lot more relaxed atmosphere, if you will, especially a live webinar with a group. And for the convenience of a lot of people, they don't have to travel anywhere. They don't have to go to the office necessarily. They can tune in to the live webinar from home. And for meeting attendees, as much as they like to go to the meetings and it's a party and all of that, it's a big expense. Hotels are expensive, and, travel and all of that. So I think it makes a big difference. So I have said to some of my friends, I love going to meetings. I love being a part of those, but I like virtual training much better. I can still be very personal, with video, which obviously isn't working today. But, with questions and answers and those types of things. And it can be much more specific rather than a group of, 500 people. This is a team of maybe 10 or 15 or 20 people, and their questions can be very specific to their practice, and the answers they get are very specific to their practice rather than to a whole big group. So I think the change to virtual training is probably the most impactful.
I think the only flip side of it, it has nothing to do with dentistry. I think it's just human beings. And I've talked to a few people about it, is some people just don't know what to do with the free time. Like, imagine we talk about saving time, not going to conferences, and some people are just like, I gotta spend time with my family. I don't know what to do.
Oh,
And it's
see,
like,
I see that as a huge plus. I've been
it
doing
is
this
like, I'm
for
with you, but I've
years.
talked to people that really don't
Yeah.
know what to do about it.
Yeah. Well, and will always be those people that, I have a lot of colleagues that are consultants and speakers, and they just can't wait to get back on the road, and they can't wait to go to conferences and things. And I'm like, no, I'm just kind of not ready to do that yet. I would rather do it virtually. It's much more comfortable. I get to be at home with my family, and maybe it's just because I've been doing it for such a long time that it doesn't have the appeal that it used to. So I view it as a very positive change. I like doing it from my home.
Right. That's amazing. That's actually a really good point. I haven't thought about it, that the whole online virtual training will change the way the conferences are done, with more specific and targeted audiences, because you're going to have more time to switch, quote unquote, the rooms. You can go from one room to the other room and talk about the different subjects.
Right.
That's going to be interesting.
Yeah. And it'll be interesting to know, especially two very major meetings, the Yankee and Chicago Midwinter. It'll be interesting to see how their virtual exhibit hall works, how successful that will be for them, because of course the exhibitors are the partners that help to drive and fund those meetings. And so they've got to have a good experience. But from the flip side, for the exhibitors, then they also don't have the huge expense of having a live physical exhibit and staff it and set it up and pay all the fees to, get the equipment and the products and things in there. So it'll be interesting in the next couple of years to see if there's going to be a shift. It may be that we end up with maybe 2 or 3 major meetings that are live in-person meetings, and some of the smaller groups, like a state dental association, will shift to do something or doing more virtual education and then have smaller meetings. I don't know. It's going to be interesting to see, but I know that, and I've told the folks at Yankee and at Chicago Midwinter that I think they made a very courageous decision, because those meetings have such a long history, and that and the Hinman meeting as well. And we don't really know what they're going to do yet. I haven't heard anything about the Hinman meeting in Atlanta in March, but these groups thrive on, all of these people coming together under the banner of Yankee Dental Congress or Chicago Midwinter Meeting, and to make such a major shift and commitments to, exhibit halls and convention centers and so forth. That has to be very impactful on them. But what they're doing is putting safety first. And so I commend them for that.
What about the New York meeting? Do you know anything about it?
Well, I have not heard anything. The last I heard was that they were still planning on having the meeting, but that could change because New York is one of the cities that is having a resurgence of cases. So don't know, and what are they going to do? That during that meeting, there is always the traditional lighting of the Christmas tree in Rockefeller Center, and that just packs in so many people. It'll be interesting to see if they're able to carry on that tradition, or they do the lighting of the tree and you don't have throngs of folks around. That could be like a super spreader event. That'll be very interesting. Yeah. And I see that the CDC is already publishing guidelines, or has published guidelines about what to do for Thanksgiving celebrations, and, about Halloween and trick-or-treating. And so, yeah.
Wow. I think we have exciting 3 months coming up to see, because I think the holidays is like what brings people together. I don't know. I think a lot of people will struggle with that.
Oh, I think they will too. I know they will struggle with that. it's going to be tough. But I can remember last spring in the middle of the early pandemic, my family celebrated Easter on Zoom. We all got together, all the different aspects of the family, and we had little Zoom meetings so everybody could see each other and say hello and talk, and it was fine. It a lot of people maybe wouldn't like it, but it seemed to work fine. I have a lot of really, really close friends back in Michigan. We have virtual cocktail hours, and you can still get together, but until we really take it seriously and try to get this virus controlled, we're just going to have kind of go up and down, up and down, up and down. And what we just need to, nobody's really said the phrase lately, flatten the curve, but that is what we need to do.
Mm-hmm. Oh yeah, it's long forgotten.
Yeah.
Yeah. Mary, is there anything that's coming up that offices need to pay attention on a compliance end?
Well, yes. I mean, the fact that we now have a precedent set with an inspection being done in a practice, I think every practice needs to make sure that their documentation is up to date. And one of the most important pieces of documentation that they may not have is a respiratory protection plan. And also to understand that in the past, if they chose to wear level 3 masks with a face shield because they couldn't get N95s, or the KN95s were counterfeit ones, that situation has changed. And so in order to protect themselves, literally protect the employees, but also to protect themselves from some kind of OSHA citation, they need to seek out N95 respirators, and they need to worry about, fit testing of those. And even the KN95s have to be fit tested because they are respirators. Now, most of the KN95s won't pass a fit test. So what I tell practices is you have to at least do your due diligence, that you make an attempt to, well, not make an attempt, you have them fit tested and you document that they didn't pass, but you wear them because there isn't a better alternative available if you're in an area where you can't get the N95. So this is what we wear, even though they don't pass a fit test, and have it documented. So it's not going to be enough for a practice, if they were inspected by OSHA, to simply say, well, we can't get N95, so we don't do any of that. They're going to want to see a log or a list of times that you contacted your supplier, or if you had, I just talked with a practice this morning that had 2 orders of N95s that they thought were coming. They prepaid them, and then their orders got canceled. And so they got their money refunded. Well, that's the kind of documentation that OSHA needs to see, that you truly can't get. You got to show that good faith effort to get the N95s. So OSHA has a template for a respiratory protection plan, but it really needs a lot of tweaking to make it meaningful for an average sort of a dental practice. So that's something that I've been doing a lot of for folks. And if you get questions about that, if you want to just kind of send them my way, I can help them with that. But they need to have that on file. They absolutely need to have that on file.
We'll make sure to have your, probably website is better, right? Or email?
Probably email. And then what I'm hoping that we're going to be able to do is get a customizable template on our website that people can access to be able to customize for their practice.
What an amazing year. That's all I can say.
I know. I want 2020, and a lot of people as well want 2020 to be over, but we don't know what 2021 is going to hold. I can't imagine it could get worse, but never say never. I don't know.
Don't know. exactly. I mean, you and I met almost like a year ago, like in October at the dance, right?
Yep, absolutely.
And I mean, things have changed dramatically.
Oh, everything's been just flipped upside down. Absolutely.
Yeah.
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 How things have changed.
Yeah. That's amazing. Well, I'm grateful that, you know, everyone around is healthy. People like you continue doing the best you can to educate and help people in the industry. And, you know, I know that we'll get through this together. I don't know how together would look like. It's definitely changing, in my opinion. But I really think that, you know, I really hope we're moving in the right direction. I do think we're moving in the right direction where somehow through these tough times, I think as far as dentistry, it will get easier. It will get easier for people to understand the guidelines. We can debate on the guidelines,
Right.
but once they're passed and become the guidelines, we're just going to follow them. And hopefully somehow, hopefully in the future, you and I will get together again on the work that we were planning to do and just try to simplify it for dental professionals to like really have it simplified with no nonsense, that they don't have to spend 6 hours, 12 hours and just get it done and really work on it. So that's what I'm hoping for.
Well, and I think, as I said before, that now that we've been through this just really horrendous disruption, and we've learned so much about public health strategies and protection, that if something like this happens again, we will be much better prepared to deal with it. We may not like it, but we'll be better prepared to deal with it. This just
and I just want to remind to people that are in US that we didn't have it that bad. Like, people died, I get it, like, but a lot of countries did not have any financial support. Like, we shut down and people were left without any income, but there was some kind of support. Like, there was these programs that are coming in and people will get the financial support. Some are late, some didn't get it, but we'll get it.
Yep.
But I really think that it wasn't, like, when I talk to people from other countries, that's what really is difficult to hear, when they were sitting home for 3 months with no support, with no financial support. They were just left and just do whatever you can, survive.
Yeah.
And I think that's horrible.
It is. It is. The toll, not just from a public health standpoint, but from a family standpoint and a mental health standpoint, has just been horrendous. And, you know, some of us have been very fortunate that we can, you know, stay in our homes in a little bubble and still have, you know, income coming in, but so many people do not. And it's not just, as you said, in the US, it's all throughout the world. I don't think they've identified any countries where that haven't been impacted by COVID-19. So, yeah, it's a scary thing.
Yeah. Mary, thank you so much.
Oh, you're so welcome.
I really appreciate you.
Great to be with
I really
you.
appreciate your time.
Absolutely. Take care.
Sounds good. Thank you. We'll talk soon.
All right. Bye-bye.
Thank you.